everyone. So I'm very excited to introduce to you a very famous dermatologist, and sir is from Australia, and I was so lucky to meet him. And he has a great following on YouTube and Instagram as well. So you can go check out his channel. But we'll start with a basic introduction.
Sure. A variety of different things. So I did initially general medicine and subspecialized into dermatology. For a while I did critical care medicine as well, training in that. And then I've been practicing solely in hair transplant for the last almost 13 years now.
Wow. For my audience, like we might have people who are undergraduates watching this. So for them, I want you to tell us, like, why Australia? You have been to so many countries,
Yes.
but why Australia? Why is it good for doctors?
So I think it's a great place for a variety of different reasons. It's you've got world-class medicine. It's a great place, very inclusive. The communities are built on a lot of different cultures, so it's a real big mixed pot of people from all over the world. Especially a city like Melbourne is just wonderful, and it's really nice. The climate. The key is that it's a really nice place. The people are really nice, okay, and there's a good quality of life.
Quality of life. That I think is not particularly there in India because we have very long working hours.
Yes.
And also like the pay scale is not that great.
So you have the flexibility of dictating, okay, I'm going to work this many hours, and that's how much I want to work, and I'm not going to work late, or you know, obviously if you're in hospital medicine then you're expected to do night shifts, but there's an understanding that everyone has a life. It's not just that your life is your work, all right? And I think that culturally is imbibed in everyone that lives there. So there's no expectation that if you come to work, you have to be there till 9, 10 o'clock at night. In offices, and all offices generally shut by 5, 6 o'clock.
Okay.
So that way it's really good.
Do you have a private practice? Are you allowed to work there as a private practitioner?
Yes. So I do hair transplant surgery, and I'm a full-time hair transplant surgeon in Melbourne, and I have my own practice, and so that gives me the flexibility, I guess, to dictate when and where.
Okay, so something for the residents, like are there any exams that we can take after residency for getting into fellowships in Australia or anywhere across the world, or are there any exams for certification or something like that?
Yes, so you have to do, if you're planning on traveling to Australia, there's a couple of things that you need to get done. First of all, you need to come on a visa. And so what sort of visa do you come on? Do you come on a student visa? That's if you're doing a postgraduate qualification. So a lot of people from India, for example, will find a postgraduate qualification that is sort of part-time, and that allows them the ability to come and travel to Australia and then at least get their foot in the door over there, right? And then whilst they're there, they may temporarily study for that qualification, and then study for their AMC. So AMC is the Australian Medical Council, and you have to study, there's a part 1 and a part 2. So you have to study for that, and that, you know, you have to do a bit of work, but obviously there's some basic sciences. So for someone, I mean, are you looking at traveling to Australia?
Let us say I am for the
video. So I think, look, if you're doing that, then it's better to try and do that early on.
So AMC I should take like during my residency.
Yes.
And then like what after that?
So once you've passed that, then it's important to try and get that first job in Australia. So you want to try and find a hospital that you can go and work at.
As a general practitioner, not as a specialist.
Not as a specialist, but not as a general practitioner. General practitioners are different. It's a field of family medicine, and you can do that in the community. So you can do it as a resident in the hospital, so either doing medical rotations or surgical rotations. And so once you've done that, then, because obviously you're very experienced, then you can look for dermatology positions and try and apply for that.
So that is one way of going there. Now, if I just want to go for a fellowship or something, I don't want to repeat my residency. What is the way about it?
In Australia. So, you know, there's some hospitals will give you temporary fellowships for 3 to 6 months.
But all of them need AMC.
No. If you're coming for a temporary fellowship, then you can get away with just having that.
Your basic degree from another country.
Correct. Yes. So it's something that if you go to Australia, my advice, okay, if you're asking for this, it would be to visit Australia. That you can do on a tourist visa, right? So go and see the place and have a feel and see if that's some place that you'd actually like to live in, right? See what you think of the people, see what you know. Of course, it's a holiday that's going to be different than living there, but if you can pitch yourself, then you go, okay, now I know I want to come here. Now you can try and find, right, what is the way to do that? And if that means I'm going to I'm going to focus on clearing the AMC, then that's what I need to do.
So that is going to act as a motivation as well.
Correct. Yeah. But you've been to Australia.
Yeah, it's a great country. It's a great country.
Yeah.
So it's like, it's very well balanced. Everybody's getting a fixed amount of pay.
Yes.
So you're not like, even if you're not a very qualified person, you're getting a decent amount of money. If you're qualified, then also you're getting almost similar amount of money.
Yes.
So there's no I would say people are not over exhausting themselves, because there are not many incentives for that, I guess.
Yeah,
People are doing it for the love of the thing that they're doing.
Yes, well, I think the key word there is balance.
Yeah.
Right, because we all have work, and my belief, okay, this is my personal belief, is that we work. Yes, we should enjoy work because we're there for a reason. But we work to earn money to do the other things in life that we want to do. Right?
That is the kind of culture we have in India. But in Australia, people are working if they love their work.
Yes, decent quality of life. And decent quality of life means two things, right?
Good money.
So it means that you have the money and you have the time.
Yeah.
If you have all the money in the world and you are working till 9 or 10 o'clock at night and you don't have the time to spend the money or do the things that you want to do, then that's, for me, that's where the problem is.
Yeah. So like when you guys are in residency, you did it from Australia. What are the books and the things that you read? Because here I am like reading Bologna.
Yes.
You must have read that.
Yes, of course. Yes, and so we did the same.
Okay.
Yeah. So I think the standard textbooks.
And there's this Derm NZ website.
Yes.
I really like that one.
Dermnet.nz.
Yeah.
Yes. So that's a New Zealand website.
Okay.
Yeah. And again, is a powerful resource.
Is there anything different that you guys do? We have a basic OPD, where we have clinical dermatology.
Yes.
We have a minor OT setup, and we have lots of inpatients. And recently, like MCI has made it compulsory for all colleges running derma courses to have lasers.
Yes.
So we have 4 big lasers, and they're very expensive ones. But the textbooks, I'd say Bologna is the main one that we read. Small books here and there, like for histopath, you read one. I'm reading Whedon's and Wolverton's.
Yes, of course. Yes.
So Whedon's I'm reading for the path part, and Wolverton for the drugs part.
Yes.
And I really don't get time. Like outside of my Bologna reading, I really get very little time.
Well, that'll take up most of your time. But here's the thing with regards to that. So you've got to also look at what the specialities are. Now, for example, in Australia, one of the big things that you see very commonly, skin cancers.
Yeah.
Because Australia is a part of the world which doesn't have an ozone.
Yeah.
So the prevalence of skin, solar-related diseases, for example, it's rampant. Okay, so the ability to be able to manage that through a variety of different sources, to be able to manage that surgically as well, takes up a lot of time for a lot of dermatologists as well. And again, it depends on where you want to be positioned. So if you're positioned in one of the major cities such as Melbourne or Sydney, well, these are large, metropolitan cities that have large universities that so you can subspecialize in a variety of different fields.